Hello, Weaver State. My name is Nicholas Parasso, and I am applying for the DMP program. A little bit about me: um, I have worked in various settings. I've done nursing, um, both in ICU setting as well as a skilled nursing facility, and I've also worked as a forest firefighter and various other things that are in my application. And I think that I'm able to take a little bit from each of those different careers and each of those different jobs that I've done, as well as things that I've done prior, a lot of sports. And I think that that has been really positive influence in my life as far as learning dedication, hard work, integrity, and responsibility. And how if you work hard and are responsible and hold yourself accountable to the goals that you set, how you're able to achieve more than what you may have initially thought possible. And so I think that I've been able to apply what I've learned from an early age in sports to my careers and my career currently as a nurse, and I will apply it to my future career as a FNP. Professionally, as I mentioned, I've worked in two different environments, an ICU and a skilled nursing facility. I've found both very rewarding, but very different and similar, but you know. So I go from a two-patient setting in ICU to 15 to 20 patients, and so I think the level of care is a lot different, but it's similar in that you're still providing care, right? It's direct patient care, and I find that very rewarding. I enjoy working with people, and I enjoy um, educating people on how they can make their lives better and how they can feel better. And so, in both of those settings, I've had the opportunity to work with advanced practice nurses, and um, although the settings are very different, the process is similar in what they do. Um, and I've been inspired by that. Um, I've been inspired by the people that I've worked with, and I know that I've been fortunate to work with really great people who focus on patient care. Um, Patient is their number one priority, and how the interdisciplinary skills required of them to work with various healthcare professionals. Um, they communicate with doctors, various therapists, nursing, uh, and family to get everybody on the same page. And it really takes a village to help a lot of people achieve the healthiest lives possible. And how the nurse practitioner role is so key in that and central um, to make that happen, to help patients live healthier lives. And as I've looked at the various information provided about doctorate nursing, um, I found it interesting the clear delineation between the the DNP versus the FNP. The DNP just being the um, academic requirement and not the role specifically. And I think that a lot of times we use that interchangeably, and I found that that was really interesting and important to separate that out. And I know that the doctorate level is the recommended level by the AACN, and that was established back in 2004. We're still working towards that. Not all programs are there, but Weber State is, and that's part of what I find so appealing to your guys' program. Um, and so, as I mentioned before, I've worked in various settings, but through those settings, I'm able to see the difference between the skilled nursing facility, which is more a primary care, um, not quite primary care, but similar to, and the ICU, which is very acute. And it's similar in that it comes down to, again, assessment, diagnosis, and treatment, but there are so many core competencies, and I thought the reading provided did a really good job of explaining and breaking down some of those core competencies, and the nine that they highlighted, I think, are really important as far as what a doctorate nurse practitioner should have these core competencies at graduation. And those core competencies are scientific leadership, quality, practice inquiry, technology and information and policy, healthcare delivery, ethics, and independent practice. Um, and all of those things are vital and very important. And as I learn and grow as a professional and individual, I think that my grasp on those competencies will and can improve. And that's part of what I found so appealing about the nursing profession when I started this career path, is that there is room for improvement. And I think that I would be doing myself a disservice and I would be doing my patients a disservice that I see by not taking advantage and not becoming the best professional and the most knowledgeable that I can be, and to focus on patient care, to look at evidence-based practice and best practice, to really effectuate lives to be the best they can. Um, as I mentioned, I've worked in an ICU setting, and that's where I currently work. I find it very rewarding, but I also see a lot of patients that um, have gone years without primary care, and how if they had had primary care and education, how a lot of these patients would not be in the ICU setting, needing the the um, the treatments and um, advanced healthcare specialists that they need at the moment that they're in the ICU. And so I would like to advance myself as a professional and individual to really expound and help people to avoid those situations, help people to live healthier lives to where they're not in the ICU. And sometimes that's unavoidable. Accidents happen, but for those that can avoid it, I would like to be a part of the effort to stop that. Um, and so, thank you for your time, and here's my application.